Welcome, everyone. This is our weekly residence meeting. This is Kylene, our head resident, and we're going to go over some charts and some difficult cases that we've had this last week, and hopefully it'll give you some insight on how we treat and how to improve your treatments in your clinic. Okay? So, Kylene, you're up first.
Okay, thanks, Bob. First patient is our 54-year-old female. She came to us overweight, tired, constipated, and worried about her heart. So we have, since treating her for 2 months, she's lost 28 pounds. We have gotten her stools to regulate, and we have been focusing on her heart. However, one of her chief complaints of fatigue has no improvement whatsoever, despite all of these physiologic changes. The herb approach has been mainly focused on opening blood flow through her chest and strengthening her heart. So thoughts on how do we now approach the fatigue issue?
Okay. Sorry about the mic situation. I just want to make sure that you can hear us. This is Carla. This is an interesting case. She's started her program's over in February, and these are 4-month plans. So what do we got? We got November, so it's December, January, February. So she's been with us a month, right? About a month?
Almost. She first came in 2 months ago.
Oh, 2 months. So she's 2 months.
I think her program is extended because she was such a severe, she had gone so far off, she needed a longer plan. So she's a 5-month.
Okay, in this case we did a 5-month plan, and one of her main complaints was she wanted to lose weight. And how much weight did she lose?
28 pounds.
Okay, so in 2 months, she's lost 28 pounds, which is great. But her fatigue is no better. And I talked to this patient last week at length because it's very rare for someone to go through this clinic with a fatigue complaint and not be dramatically better, especially after 2 months of treatment. Just doesn't happen that often. So after examining her and looking at her pulse and talking to her, I first of all became convinced that in fact her fatigue had not improved. Sometimes people just make up stuff. You have to be careful. I mean, if the pulse is much better and they're still complaining about something, then you have to be wary because they are better. And sometimes you just have to tell them you're definitely better. But in this case, I saw clearly that she's not. But what's interesting was the pulse is better in her heart. The pulse is better. It's not clogged up anymore. And yet her insomnia is the same, and she still feels this uncommon tiredness. What's interesting about her tiredness is that it's cyclical in nature. She's tired, and then she kind of straightens up for a day or two, then she gets tired and straightened up for a few days, and so on. So finally, I began to ask her a lot of questions about her life. Where did she live, and so forth. And what was very interesting about this patient is that I believe she's the one, because we have 2 of these girls, this is the one that lived overseas for some time. She lived in foreign countries. And what was it, Egypt or Africa? I think this is the Egypt gal. She lived in Egypt and there for quite some time. And so I became convinced that this woman has a parasitic infection. And these infections from foreign countries are almost always a bug called Amoebic histolytica. And they can have a Giardia infection, but usually it's an Amoebic infection. And this is one of the typical diseases that are very difficult to fix with Chinese herbal medicine. I believe you cannot kill that bug with Chinese herbal medicine, and I have tried. I did my thesis in school, my master's thesis in parasitology. So I know a lot about it, and I've traveled in so many countries around the world and lived in other countries that I've actually had 9 infections myself. So I know a lot about this. And these type of patients will not respond very well to Chinese herbal medicine or acupuncture. They will get better, but then they fall back, and they get better and they fall back, and they just go round and around. And they will drive you nuts because you're convinced you're doing something wrong, and you can get easily discouraged. You should ask the patient at length about where they lived and so forth. You have to be very specific. If you ask them, did you ever go to Mexico? You can get this in Mexico. Yes, I did go to Mexico. How long have you been tired? Ever since the Mexico trip. Or I went to Nepal, I went here, I went there. Those countries, it's almost a slam dunk that you will get an infection in any of those countries. Now, sometimes the people have never traveled outside the country, but it turns out they did a lot of camping and they like to swim in the lakes and the rivers. And in Washington State, here in the United States, these lakes and rivers are teeming with Giardia. And it's very difficult to swim in a lake and not get, the water in your mouth. And of course, then you end up with an amoebic infection. So beware of these chronic fatigue problems that do not recover. You start thinking about parasites. And you have to kill these little critters with drugs. There are 3 drugs available for your use around the world. Flagyl, metronidazole, you can use that. That's 250 milligrams 3 times a day for 10 days. That's a typical doctor's dose. I am not prescribing that. I'm just saying that's what the typical dosage is. You have to make sure that you have a 10-day dosage. 7 days will not do. These are sexually transmitted diseases, so both partners, if there is a sexual partner, both partners have to take the drug at the same time, even if the other partner has no symptomology at all, because you will pass it back and forth. It's a fecal-oral route, but in the sex act, there's all kinds of things going on, so you have to be careful. Sorry about that, but that's the truth. The other drug is paramomycin, which used to be called Humatin. That can be used. That's 250 milligrams 3 times a day for 10 days. And then Pfizer just came out with tinizidol in the United States. It's been available in India for years. That's 250 milligrams 3 times a day for 3 days. Then you wait 10 days, and then you do it again for 3 days. Those drugs will kill those bugs. And the patient will feel a little better, but not necessarily tremendously better in the beginning. Then the Chinese medicine, though, will work after the dose of these drugs. Then it works. Then they start responding. Take a look at this gal. She lost 28 pounds, and she's not extremely heavy. This woman is probably, 40 pounds overweight max. And she lost 28 of them, and the fatigue is no change whatsoever. Something's dramatically wrong. Something's not right. And of course, these people, almost all patients have already seen all the doctors, and they can't figure out what's the matter with them. But the thing that Western medicine always forgets about, parasitology. And the only time they ever study parasitology is in med school one day, and they study liver abscesses from Giardia infections, which can kill you. So when you say parasites to a GP, they immediately think of someone very sick that's in the hospital. They do not realize that these little critters can live in the mucoid of the colon all your life without ever working their way through the colon to abscess in your liver. So that's just a tip for chronic fatigue cases. If they're not responding, and you've got a lot of Huang Qi, if they have weak pulses and you're using Huang Qi and Dongshen and all that stuff, and there's no effect whatsoever, start doing a real medical history and figure out where these people were. And you'll discover all kinds of interesting things. Well, I lived in China for a year. I lived in India for a year. I lived in Nepal, Mexico. I went to college in Mexico. You can just bet they have an amoebic infection. Okay? So we'll see you in the next episode.